Are root canals dangerous? Root canals are one of the most discussed topics in holistic dentistry. This video is a little longer because I'd like to take the time to share my thoughts in a thoughtful and thorough way. Over 100 years ago, dentist and researcher Dr. Weston Price showed that even after a root canal, bacteria can remain in the microscopic dental tubules of the tooth. That's one reason this topic still comes up in holistic dentistry today, that these bacteria in the tubules can be a chronic problem. But in whole health holistic dentistry, the answer is not the same for everyone. Some people have autoimmune disease, allergies, chronic inflammatory conditions, or undiagnosed medical problems. And in those patients, I tend to advise against a root canal. Sometimes I'll even consult their functional medicine doctor first before making a decision. But a healthy person with a strong immune system is a different situation. Your immune system is constantly fighting bacteria throughout your body every day. The bacteria that may remain in the tubules would be handled by the immune system. So in those cases, a root canal may be a reasonable option to preserve the tooth. However, when we do consider a root canal, I like to work with an endodontic specialist, as it is a very precise procedure done with a microscope. And a bioceramic sealer such as EndoSequence is preferable, and it is considered more biologically compatible. But before recommending the procedure, I also need to determine whether the tooth is predictably restorable and has a good long-term prognosis. For an immune-compromised patient, medical conditions, allergies, autoimmune conditions, etc., root canal treatment may not be ideal. Extraction then becomes part of the conversation, but you also have to consider how that patient will heal after an extraction and how they will tolerate the procedures to replace the tooth if that is decided. And if it is extracted, does it even need to be replaced? For example, the very last molar, the second molar, is what I sometimes call the least important tooth. Many people lose those teeth and rarely miss them. The first molar, however, is an important chewing tooth, and other teeth may be involved in the smile and phonetics. So we may ask questions like, does the tooth really need to be saved? If so, is root canal treatment compatible with this patient? If it's removed, does it even need to be replaced? And if so, what is the best way to replace it? And what are the long-term risks and benefits? A helpful way to think about it is with knee surgery. Sometimes an orthopedic surgeon can treat a knee problem with arthroscopy, preserving the natural joint. But many factors need to be considered, just like with a root canal: overall health, immune system, other medical conditions, medications, etc. Other times the joint is too damaged, and the better solution is a knee replacement, like extracting and replacing a tooth. So dentistry can be very similar. A root canal may be thought of like arthroscopy. We're trying to preserve the natural tooth. An extraction replacement will be more like a knee replacement, removing the structure and replacing it with something artificial. Whole health dentistry doesn't follow the idea that, well, here's the problem, so here's the treatment. The decision is much deeper than that. It requires understanding the individual patient, taking the time to think carefully about what is truly best for them. It considers not just the tooth, but also the whole person, the health of that person, and the long-term outcome for the whole body. Dentistry typically just treats the tooth, but whole health holistic dentistry treats the whole person. That's why the question, are root canals dangerous, doesn't have an easy answer. Visit holisticdentallearning.com to learn more. And now that I'm easing into retirement from everyday clinical practice, I'm happy to be of service with holistic consultations.